I went to college at Brown, and I went to medical school at Cornell, and after Cornell I did my residency in Obstetrics and Gynecology at Pennsylvania Hospital. I then did a Master's of Public Health at Mount Sinai and went on to do another residency in preventive medicine. So I'm double boarded in Obstetrics and Gynecology as well as preventive medicine. I came here because there was an opportunity to be the chief of obstetrics and gynecology at Mount Sinai Queens to not only practice medicine, but also to create programs and affect the way women's health is administered in our hospital. It's a place where patients can feel comfortable in a community setting close to their home, where the nurses really care for you. The staff work their hardest to give you the best care. And if you can have all that with the best of technology and cutting edge techniques available to you, I think that that's a really great place for a patient to be. The majority of patients I see are gynecological patients, and that means that they come in with a variety of different problems. One of the more common problems is fibroids, and this is a problem that afflicts maybe about 25 to 30% of women. They can either have no symptoms or sometimes they suffer horribly with a lot of bleeding and pain. And of course, our job is to try to offer options to give them relief of their symptoms. When hysterectomies were offered as the only treatment option many years ago, it was given by a large abdominal incision, and these days we have many other treatments, non-surgical as well as minimally invasive surgical treatments, which involve very small incisions in the abdomen or even approaches through the vagina that leave you with much smaller incisions and shorter recovery time and definitely less pain with your recovery. I did have a patient who came in, and this patient was given one option and one option only by her previous gynecologist. And I informed her that there are many options for treatment. And so there were minimally invasive options, there were non-surgical options, and there were surgical options as well. And she was incredibly grateful and thankful that we had been able to discuss the wide range of options that are available at Mount Sinai Queens. Eventually, she did opt for surgery, and the surgery, though, that we did opt for her was a minimally invasive technique, which was something that her previous gynecologist had not offered her. And I felt very good about that also, as did she, because we told her we could get her back on her feet much faster than with a traditional hysterectomy. We could offer her less pain in her recovery and just a much smoother recovery.